Okay, I think we have a good amount of people here to go ahead and get started. And for everyone else who joins, this is recorded as always, so you can always rewind and go back to the beginning. So thank you all for joining us for today's presentation, The Role of Progesterone Testing in Canine Pregnancy, Part 2, with our guest, Dr. Andrea Hesser, a board-certified reproductive veterinarian. So this follows Part 1 of our discussion earlier this month, and Dr. Hesser is going to be teaching us about how progesterone testing provides insights to help you know the optimal breeding time for your female based on the type of semen and method of breeding. And she's also going to cover how to monitor the progesterone level during pregnancy and what to expect in late pregnancy close to term, as well as supplemental progesterone options. So this is a follow-on to Part 1 that we hosted, I believe, 2 weeks ago. So in case you missed that, we're going to drop the link to that in the chat, so you can always watch that after this. And we just want to thank Purina again for helping us bring this webinar to you. This is something that we're really excited to cover with our community. It has been such an amazing experience to bring you all of these webinars for free this entire year, and we have many plans to continue them throughout the rest of the year, but we are so grateful for Purina, as always, for helping us bring these to life every month. During the Q&A segment of this presentation, we're going to prioritize those previously submitted questions, but as always, please feel free to use the chat to ask questions as well, and we'll do our best to answer those as best we can. And I just want to share a little more about Good Dog for anyone who is new and joining us and has no idea who we are and what we do. We're on a mission to build a better world for our dogs and the people who love them by advocating for dog breeders, educating the public, and promoting canine health through events just like this and responsible dog ownership. We're a secure online community that is created just for responsible dog breeders to connect with serious, quality Good Dog applicants from all across the country to find forever homes for your puppies. We help breeders place their puppies securely with our best-in-class software to post your available litters, connect with Good Dog applicants, and also access a number of free educational resources, many more in addition to events just like this, and discounts to really help your breeding programs thrive. So if you're not yet a member of our community, we would absolutely love to have you join us, and you can do so by applying at the link that we'll drop in the chat. It's gooddog.com/join, very easy to remember. And without further ado, I just want to share a little bit more about Dr. Hesser and her amazing background in canine health before I pass things over to her. Dr. Hesser is a board-certified reproductive veterinarian who practices in small animal medicine in the Dallas-Fort Worth area. Her clinical time is spent in general practice, veterinary medicine, and reproductive consultations and surgery. Dr. Hesser also provides semen collection and health testing services at local dog shows, which is very cool. She's a longtime canine breeder and enthusiast with an interest in whippets and bull mastiffs. I have 2 beautiful whippets that live in my building, and every time I get in the elevator with them, I'm so excited. Her mission is to serve breeders by helping them achieve their goals with their breeding programs. We are very aligned in that mission. So without further ado, Dr. Hesser, I'll pass things over to you to get the presentation started.
All right, thanks, Nicole. I appreciate you guys having me back for another week. And I think the link should reflect that, but the last seminar, just so you guys know, that connects to this one. So the Part 1 that we're going to kind of lead off from, it happened a week ago. So if that helps anybody, it should have been the September 11th at 4 p.m. Eastern Standard Time would have been the last one. If that's, I don't know if that's helpful, but all right, so without further ado, it sounds like we had an Aussie breeder in the mix there on the chat, and I would say I adored this litter. This was a litter that a long time ago, actually, that Nini LeBlanc, Yvette LeBlanc had, and some of these puppies went on to some really spectacular stuff. But if I remember right, I think this was a Rowan litter a long time ago for those guys that are Aussie people. So, all right, we're going to move through some of the things we didn't get to last week, and then we're going to go over, like Nicole had mentioned, we're going to talk a little bit more about pregnancy progesterone levels, like as they're going through pregnancy, monitoring techniques, and supplementation. But we didn't quite get through a case that I just wanted to show you for ovulation timing. So we won't go through the nitty-gritty, but just as a brief review. So we were looking at the progression through the cycle, kind of the perspective of days after her progesterone rises, and how we would decide when we're going to breed her, how you might be advised to breed her. So we're using a combination of techniques. We're going to look at cytology, which is going to help indicate how frequently to do our progesterone. Sometimes the progesterones themselves will indicate how it will help us understand like how frequently we need to test. So occasionally it's also affected by the type of semen. So say you're doing frozen semen breeding, well, you might be testing progesterone more frequently because you want to know more detail of how the progression goes. We may also be looking at LH as far as a way to help us with timing, and vaginoscopy, which is just looking in the vaginal tract with a scope or even like a small little camera, handheld camera. And behavior certainly is a good thing to note too. So, and then just as a reminder, we were talking a little bit about techniques. That's kind of where we left off. So we had talked a little bit about vaginal insemination very briefly, and natural breeding. And then also I think it's always kind of a hot discussion topic, and people always have a lot of questions about surgical versus transcervical and which should we be doing, and what makes the more sense, and when does the timing happen for those sorts of inseminations in relation to their progesterone levels. So success rate wise, I know I popped this up last time too, but just as a refresher, we expect, so this chart, I know it's a little bit busy. Basically, this is about 1,000, I think it's over 1,000 dogs that were factored into these numbers. This was a private practice that I have had worked at in the past. These were numbers as of probably 2019. That had been kind of accumulated in this practice from healthy cycles, so bitches that did pretty normal things, and they kind of compiled the data in an Excel document and then generated some of this info. So the chart is vaginal insemination along the top, 1 breeding/2 would be where those percents come from. So like the first box, the vaginal insemination box that crosses with fresh, 78% of dogs got pregnant with 1 vaginal insemination with good numbers of sperm. So with like a normal looking ejaculate or collection for that breed. 89% of the time, if you bred them twice with fresh semen vaginally, you got a pregnancy. This also is kind of, this chart, even though it's a little bit busy, represents a lot of breeds. So this isn't just, if you just breed Labradors, well, this might not be exactly what you would see. And so some of our choices and experiences come from those sorts of kind of breed predispositions. I would just say like giant breed dogs, well, doing a vaginal insemination with a pipette, you're not going to get nearly as far forward in the tract. So you're asking the semen to do a lot more work. So I think those guys get disadvantaged when we do things like vaginal inseminations, which is why a lot of people lean on transcervical or surgical for giant breed dogs, because we just flat out get better success. Whereas sometimes there's some groups of breeds. So example would be Scotties. People don't often think about Scotties, but the way that that Scotties are generally bred is through vaginal, well, at least in my part of the country, I should say, lots of breeders do their own vaginal AIs. They don't ever do naturals because the girls tend to be spicy, and not a lot of them want to stand to be bred because they're terriers, right? But also the boys have a hard time mounting because the way those dogs are built, they tend to be pretty front heavy and kind of wide across their front end. They don't have very much length to their legs, so it's pretty hard for that male to effectively breed the female. And that's the same can be said for a lot of different breeds. So bulldogs, dachshunds, some can certainly, but when we deal with breeds like that, well, those breeds might be a lot more likely to take with vaginal insemination because that's the only way we've asked them to get pregnant for a while. We basically selected for it. So just note that as a side mention. But the takeaway from this chart, so the first column, vaginal insemination, your success rate, if you're doing fresh or chilled, basically you're going to be in the 70s as far as success. Fresh or chilled with 2 breedings with vaginal insemination, you're going to up your game a little bit and get a little bit more likelihood of getting pregnant in that scenario. And basically, there's not as much improvement when we do that same type of thing, but we're using those same types of semen with TCI. We get a little bit more of them pregnant. And if you're in that 5%, say if you did chilled TCIs and 5% more of the times your bitch got pregnant, for me, I'm going to do 2 because I would rather be in the pregnant group than not in the pregnant group. I rearrange my life to have a litter when I have a litter. So it's important to me. And then the other thing to know, again, we don't do frozen vaginal inseminations. The two options that we have are TCI and surgical insemination. And most of the statistics that are out there say there's not a difference between one versus the other. But I think a lot of private practices that are generating their own data, if they're good at TCI, if they're using TCI as part of their regular practice for breeding, and they use it all day long, well, those guys are outperforming a little bit on TCI over surgery with all methods. So basically with everything but fresh. I think the fresh guys, like in this data, fresh surgical insemination being 85%. Well, the ones that are getting fresh surgical inseminations, even if their cycles were normal, they're probably the bitches that came from lines where the owners were leaning towards aggressive measures because they can't get anything pregnant, right? A lot of people elect for fresh semen and surgical insemination if they are trying to do everything they possibly can from the owner's perspective. Those are the things they're already kind of setting up to try. And so I think, that is probably not as different, when you look at this chart. All right. Oh, is one better than the other? The short answer is yes. So the lab data that we have that's like really good, reliable research says that basically that they can get pregnant at the same rate. And the reality is that TCI is less invasive, less risk to the dog, faster, less expensive. There's lots of reasons why. I think if we're saying they're equal from most perspectives in conception rates, that we are not probably leaning towards surgical as our first recommendation. But the question is, does your vet have the equipment? A lot of people don't, at least in the US. I would say, like in my part of the country, and please correct me if I'm wrong, and I admit, I don't know everybody in the business, right? But I would say in the Dallas-Fort Worth metro, we have people drive from states or two states from us to come to us for TCI, or that are traveling from a long distance to come to these clinics that are a little bit more in a busier area. Like in Dallas, well, there's 3-4 people that have TCI in the Dallas-Fort Worth metro. In the state of Oklahoma, I don't think there's anyone active except for, there was one clinic that was real active in kind of outside of Oklahoma City. Those guys, I'm pretty sure the person that was doing a lot of that work passed away from cancer within the last year or two. So we lost the only person that was. Arkansas has nobody. New Mexico that I know of has nobody. There are some new vet schools that are coming up and coming up in all parts of the country. So it might be that we have a little bit more availability, but as many of you know, some of the vet schools have no small animal program for repro. So I think, if your vet doesn't have the equipment, I think opting for surgical for the purpose of increasing your odds in an otherwise healthy bitch, it's a personal call, but I think it's reasonable. If that's what you have available and that's what makes sense for the breeding that you're trying to do. The question on availability also has to do with skill set. So you can have all this equipment, and if you don't know what you're doing, it's not like you just get a manual with it when you buy one and then you just instantly have skill with it. I would say younger generation veterinarians have an easier time learning this because they are accustomed to video games. So this is very much, it's a video-based scope system. So I think that's definitely balls in that corner for younger generations to be able to learn this pretty easily and get the handedness of it. It does take practice. When I first was in practice, it probably took me, for most dogs, it would take me at least half an hour to navigate up to the cervix. Like, it took some time. And I know it sounds extreme. Some of you guys that have super slick vets that do them really fast, you realize like that's a long time. It's a long time for her to hold still and like stand on a table. I would just say probably 50% of them now I could do in under a minute. And that there are still some out there that'll sit there for half an hour and finally get in, or some that we give up and we say we're not gonna, we don't want to do any damage by being traumatic up there. We don't want to manipulate her too much. So if we need to, we convert to surgery in those scenarios. Listen to your vet though. If they have the equipment and they don't say, you should use this. I would probably say if it's not critical for you to get your bitch pregnant this time, it's great for them to learn how to do this, and for you as a breeder to support them getting better at it. And if they can do it with fresh or with chilled on bitches that are great to stand for procedures and real easygoing dogs, that sort of thing, it's great to be able to let them take the time to do it. But if this is a scenario where it's a high stakes frozen semen scenario, well, yeah, I mean, I would just plan a surgery. If they're not super confident with their skill, we have to be able to pass the catheter in order to be able to do the procedure properly. We also don't want to do TCI in cases where I'm pretty confident that she had cysts or pyometra history. So if we know she had a pyometra history, I will encourage that as an option, surgery being a possible option. We usually will ultrasound for cysts in the uterus on those cases post-treatment of their pyo. Like when they come back in season, we will check them and say, like, what are we planning? Sometimes the answer is the owner's like, oh, we're going to do a natural. But if they want to do a natural, that's fine, but we probably should do surgery as a component of the breeding process, at the end of the cycle or what have you, during the cycle, so that we can go in and express this manually if we can. If we don't see anything on an ultrasound in a pyometra history case, I think you can make a decision either way. But usually if they've had a pyo, they have some cysts associated with that. It's kind of a chicken or the egg scenario, but usually they've still got them. The other thing I think there is some thought to, sometimes I just want to see what her uterus looks like, or I think she's got something weird on an ovary, or something that we saw in ultrasound that we're like, I really would rather do an explore as part of this. If you're already going to be doing something and it could, be kind of a kill two birds scenario, I think that's a perfectly reasonable choice. And of course, the last one, did your vet try to perform a TCI last time and didn't get her pregnant or couldn't catheterize her? Well, yeah, of course, in that scenario, she needs a surgery as a preference if she's going to have an intrauterine breeding. So just so you guys know, in case if you're people that like to read, so this is the study link is at the bottom there. There's a couple studies that Dr. Mason produced that's out of Australia. He's a boarded specialist in Australia, and he just hired a statistician to go through his data from his clinic. And they pulled out the first paper that they did. They pulled out 125 bitches, varying breeds, varying ages. I think it was 1 to 7 years old. And it was a real world study. It wasn't like a hyper fertile group of dogs. So like all the other studies that we have on success rates with, progesterone testing and going through and doing everything right, it's all on these like super fertile populations of beagles that like their whole life and job and their lines and everything that has to do with them have been selected for them to get pregnant. Well, those dogs are going to make everything look better than it is. So this was really exciting because we really had something real to compare to for our clients to say, like, this is what we see. So when they went through and did like analysis on this, they basically broke dogs into groups of did they have enough sperm. So what they cut off as a minimum amount of sperm was 150 million. So that's what that TPMS, total progressively motile sperm. Less than 150 million got put into a different category just so that they could say the ones that had plenty of sperm, based on what we usually expect with frozen semen, are not being skewed off by the guys that just didn't have enough sperm, and that's why they didn't get pregnant. Versus, it's just there's just a lot of variables, so they tried to take that out as a variable. So in this study, like I said, this is the study that we reference. So we say the TCI was statistically equal to the surgery for getting things pregnant in a real world scenario. More bitches got pregnant with TCI on paper, but there were, because it was 125 dogs, you'd need 1,000 dogs or more dogs for it to be actually like more than just a number that's pretty comparable. I think, and I might be off on this, but I think it was like 7 in the 70s as far as success rate, 70% success on the group of TCI dogs, and I think it was like 69 or something like that on the surgical insemination dogs. So just FYI. Okay, I think we pretty much beat this to death. So let's skip that. But why do we think TCI might outperform surgical? Like it's possible. There's some people that talk about and propose it. Well, we think there's things that we do to them. So anesthetic impacts. We anesthetize them. Like if we say something as simple as just stress can make bitches not get pregnant, people say like, oh yeah, she was stressed because I brought her to the stud dog and she was in the kennel and she doesn't like that. Well, anesthesia is like, it's a big impact on your body if you go under anesthesia. It affects how your digestive system acts. It affects how you feel for 24 hours. You could be in a state of stress. Like there's lots of things, and not to mention drugs that we use for it. Even if they're safe, like does that impact it? I think relaxation of the cervix is a biggie. But that being said, it's a small part of things. I think the cervix is there to keep things in, is the idea, right? Like once the semen is in the uterus, they don't want it to come back out the other direction. Well, if she's asleep on a table upside down, it's not going to be exactly the same as if a dog bred her, that was breeding her naturally, say. The Ferguson reflex is a stimulation that happens. It's if you have ever watched a natural breeding or a TCI or a vaginal insemination where they've feathered the bitch, is what we call it, or a natural breeding where you see this bitch like contracting, like her abdomen starts contracting, and you like hear her grunt, and she like gets rigid. That's the Ferguson reflex. It basically is an important part of the body changing the way that it basically asks the semen to go toward the ovaries. It's the body's like contracting in the right direction for things to be going in the right way. And that happens from stimulation. Well, when they're asleep, they are not stimulated. And they're, like I said, their cervix is a barn door and it's just as relaxed as it can be because the dog's asleep. Other thoughts, inflammation from healing. We can't really give them the right pain meds because we can't manage a lot of things that we normally do kind of post-operatively. So in just the stress of the event in general, I think can have an impact. So versus the dog that walks in again with the TCI, walks in, chops on the table. We put semen in her and we talk to mom and we walk them to the front and we check them out. And it's simple and easy. I think, in good practices that are pretty used to doing it. Okay, so we're past that section of things. I just wanted to mention this is another one of those questions a lot of people discuss, is that 1 versus 2. For me, I always plan for 2, especially for chilled shipments. Frozen, also, it's nice to have extra semen in case it doesn't thaw well. I think we're trying to minimize the scenario where we don't have semen to use. Whenever we've done all this timing and like gone through all this effort, we guys spend a lot of money on progesterone tests and the like. So we want to make sure that we don't end up in a bind. I think planning for 2, and sometimes you don't need to, is a perfectly reasonable strategy. I usually go for 2 because, like I said, I want to be in that percent that gets pregnant, even if it's a 5% difference. I know it's a lot more money, and for a lot of people, it's going to be another $1,000, right? For like a chilled shipment, you got to pay for that stud dog's semen to be collected, packaged, shipped. Then you got to pay for another TCI. So it's a personal choice. But sometimes things happen even when you plan for 2, right? So FedEx is late, they lose your box, stud dog won't collect, stud dog it has bad semen. Sometimes we go the first time to go collect them and they looked great last week, and then this time there's tons of blood in their ejaculate and there's nothing we can do to send it anywhere. Sometimes it's whether or not the vet's open. Can the stud dog ship based on where he lives? Can he make 2 trips? Is it a holiday weekend? Are you just a super lucky person that ended up catching, a holiday right when you needed to get semen? And sometimes that happens too. So I think the other thing, as far as the discussion on 2 breedings, because a lot of people, the tendency is breed them as many times as you can. Like if you have natural breedings, I've had plenty of like super infertile dogs, and like the owner will tell me we're collecting semen to like bank to try to put as much semen as we can into this bitch that's like super high profile. We've tried to breed her 100 times, and they tell me that they've bred their stud dog to them every single day for the last week, leading up to the breeding that we're trying to do with good timing, and like not a good thing to do to a uterus. Uterus does not like sperm, so like breeding them over and over and over and over and over is not a great strategy. It works just fine for plenty of dogs. It works just fine, but if you're dealing with like a situation with the kind of a high profile breeding, and your bitch has missed in the past, or like you have some issues with your lines trying to get them pregnant, breeding them over and over and over is probably not the strategy you want to use. So post-breeding endometritis is a mare problem. So in horses, there are plenty of horses that we cannot breed them more than once. We breed them once with a very small volume of semen to make their uterus as happy as possible. Because if you breed them with a ton of semen or breed them multiple times, they get all this fluid accumulation in their uterus and they don't take, because they're being bred and bred and bred and bred, which is, I think there's arguments of, are we perpetuating this, right, by like fine tuning all of this? Well, yeah, we're probably the horses that can get pregnant on a whim and don't mind, being bred a bunch of times. Well, those are going to be more likely to be good fertile animals, to produce other good fertile animals. But the reality is we pick all these very specific characteristics of our dogs. We're not focused on reproductive criteria in general. We're not looking at how big was her litter size as far as who we're going to breed going forward per se. We're more thinking, did she produce a master hunter? Was she clean on her health testing? Did she get a best in show? Those are the kind of things that we're more interested in as exhibitors and owners, I would say, in general, at least in my side of the pond. Okay, so back to timing. I just wanted to mention some of those kind of things with the breeding, since timing and breeding are kind of commingled. There's just no way to talk about one without the other. So this is one of my bitches from, and you can, I don't know if you can tell how young I was here, but this was in vet school. I actually think this was in vet school. I had a bitch called Flower. At the time she was 6 years old. Rottweiler bitch. For those of you that have other breeds, not real familiar with Rottweilers, they're not real blessed with longevity. A lot of people are not keen to breed their bitches real late in life. I mean, they're definitely not. They're large giant breed kind of dogs in that way, but I'd say kind of average on a fertility spectrum. They do pretty well sometimes when they're bred later in life. She had a litter at 4, so she had 4 puppies when she was 4 years old. Basically, the first time she was bred with her breeder, I co-owned her with her, and I sent her to her for the first breeding and litter. She had a vaginal insemination because her stud dog couldn't figure it out, and they didn't have a good backup plan, so they did their own like at-home vaginals. And she got pregnant and whelped her puppies, and everything went really well. So I had kind of an idea of what her cycles do. She's a pretty regular cycler, had a pretty normal progesterone scheme the last time. So I was planning, though, I had a stud dog in mind that was chilled. So he was going to be shipping. I was in Northern California at the time. He was shipping from Southern California. I just didn't have the means to get down there to use him naturally. And it was easy for me to facilitate those TCIs for her. So we started her timing. So this is just a example of kind of how bitches will progress. If you guys, some of you guys, this is old hat, right? So you'll know exactly how this looks. So she starts bleeding. It's the 15th. It's a Monday. Starts bleeding. She's historically a dog that takes a couple weeks to go through a heat cycle. She's also the dog, though, that like you could blow on this dog from across the room and she will lortose and rigid up like she is standing. She will stand to be bred for 2 weeks. So I started her testing a weekend because she's just never like been a racehorse as far as being like quick through a cycle. So I started her progesterone and cytology on the 22nd and had everything kind of organized on the stud dog side. So we were all kind of had our ducks in a row. Well, her first progesterone cytology looked great. Very much an estrous cytology, no surprise there. Progesterone was 1.4 nanograms per mil that first day. So at that point, she's fairly early, but she's already kind of doing something. So like if she had been 0.4, I might have taken a little bit more time, maybe checked her in 3 days. But since she's already kind of doing something, I checked her in 2 days. So in 2 days, she's not doing anything. So Don't be alarmed. This is totally fine if they do this. She hasn't done anything. Even if she went down and she went back up, I'm fine with that. Like, it doesn't change how I view her. Her cytology continued to look estrus. She still, acted behaviorally very much like she was estrus and happy to flirt. So we checked her on Friday. So 2 days later, she's gone from 1.4 to 4.2. Now we don't know what she did on the 25th. So that I think from a teaching perspective, it's nice to have those types of trends for you guys to see. But in a real world scenario, this is what you're going to see with your own dogs. So she's at a 4.2. We're coming into the weekend. I'm wanting to ship semen. So I talked to the stud owner when she's at that level on Friday, and I said, here's where we are. She can't ship Friday for Saturday. And I think for some veterinarians, they might start recommending that. They might already be talking about getting semen because they're worried about the weekend coming up. And what is she going to do? Some dogs would sit at a 4, go to a 5, take their time. Some dogs would go up and go forward. So I think you can, the trick is you don't want to be so conservative that you end up having to ship semen 3 times if you shipped it early. But the nice thing is you could, if you needed to. So I think being cautious, if you have the budget to do it, is always a good plan. For me, what I chose to do, I chose to talk to my stud owner on Friday, and I said, look, here's what we're going to do. Plan Saturday to ship for Monday. So I told him I want semen for Monday. Ship it regardless, because no matter what she does, if she's already at a 4.2, she's going to be somewhere where I'm going to want to put semen in her. Even if she's putzing around and not doing anything she should, I will feel nervous not having semen by Monday, just around, just to make sure I have it. And then we'll make a plan if we want to do Monday for Tuesday or Tuesday for Wednesday, like depending on what she does. So we check her on Saturday, and she's at 10.9. So from those numbers, I now know she ovulated on Friday because, like we talked about last week, 3 nanograms per mil rise in 24 hours is documentation. So we know that she ovulated the day that she was at 4.2. Her cytology still looked great. On that day, she had the 10.92. Her cytology was pretty much the same this entire time I tested her. She was estrus, like flying colors estrus the whole time. Like I said, this dog loves estrogen. She just stands like a brick house. Okay, so that basically lined me up for perfect timing. So that makes Monday basically +3 from when she ovulated. So smack dab in the middle. Now I'm probably flirting with a little bit of fire. If like FedEx screwed it up and they couldn't collect them on Monday, well, I would be screwed, right? But fortunately, they were able to collect them Saturday and ship for Monday. Collected Monday, shipped for Tuesday. We bred her those 2 days. And so again, ovulated on the 26th. And then we didn't do an LH test for her, but we presume her LH happened on the 24th. Now, if you remember from our discussions last week, so in progesterone terms, we expect LH to happen between 1 and 3 nanograms per mil. But it's pretty much decided if you were testing her every day, it basically means what she had to have done is on the 25th, if we had tested her progesterone that day, she would have been probably 2.8 or higher because she would have had to double that 1.4 in 24 hours to be kind of classic for that LH. So just so you guys know, that's kind of what we would expect. Oops, wrong way. Okay, and then as far as due dates go, so since we, can project that from our ovulation dates, we can talk about that a little bit. But basically, oh, you know what? I'm sorry about that. I wrote due dates on the top of this. I'm not sure why. So this is just discussing again. We have ranges of when we expect the most fertile window to be. So even though you can breed outside of this in some scenarios and be successful, 1 and 3 days post-ovulation or 2 and 4 days post-ovulation is generally when we discuss timing for breeding for fresh and chilled. Well, in my particular dog, she was bred on 3 and 4 because that's what we had available. Had it not been the weekend, I probably would have tried to get semen on 2 and 4 or 2 and 3 or something like that. They're all individuals. Some of them, I think some of them will progress faster in their cycle from a progesterone numbers perspective. But remember, we're not as worried about like her being a racehorse. If she if Flower went from 4.2 to 10.9 and I tested her on Monday and she was 35, I would have been fine with it. And I would have bred her on Tuesday, just like I had planned, because they can go as fast and as high as they want. Some of them will go really dramatically high and some of them won't, but it's the days from ovulation that we're so much, focused on. But as far as timing for breeding, just be aware that so TCI and surgical insemination are preferred in the later days of fertility due to cervical closure. I know that's kind of a hot word that people will mention. Their cervixes aren't going to close like a jewelry box. It's not like an all or nothing closure. It's more physiologic. So we can go through it with a scope, no problem. We can go through with the catheter. We can go through with the whole scope through most cervices at any point in their cycle. The difference is the way that the body interprets allowing things through those crypts in the cervix, because it's not a very big opening. And if things like flagella, so the little picture on the bottom right is just a reminder of what that means. So those little finger-like projections that are on the surface of cells in a lot of mucosal areas, they have lots of roles. One of the roles of the cervical ones is to make sperm go in the right direction. Well, if they are at the end of their cycle and they're pretty well out of their cycle, if you put semen in the vaginal tract and the cilia are beating or the flagella and cilia, I think actually, are beating the wrong way, those cilia are going to work against the ability of those sperm to get through that cervical opening. So that's more what that means. So other kind of weirdo cycle things that they can do. Silent heats are one that is it's just kind of an annoyance for most people, because they will not realize their dog is in heat. It basically means that the heat signs are difficult to notice. So the dog is in heat, the dog has had a heat cycle, and by the time you realize it, she's either been bred as an oops by a male in your house because you didn't realize she was in season and you've been running them together, or you missed the cycle completely when you were trying to set her up to be bred that cycle, and you realize after the fact or at the very last moment that was estrus kind of signs or behavior, even though it was way more subtle than normal. Usually most people just describe it as lack of bleeding, but it can also be lack of swelling. So like if you have a breed that doesn't have real overt bleeding, sometimes it's just, you just can't tell at all. Some people will consider this lack of reception. I mean, there's lots of dogs that don't like being bred naturally and will refuse stud dogs and have overly obvious heat signs. So I think that's not as much of a important thing as far as defining it as silent heat. So they're just as fertile as non-silent heats. That's why they're so annoying, because we could have bred them on it if we were able to figure it out and get semen in time. They follow the same patterns. They aren't faster. It's just the perception, because we don't know that they're happening. And then we panic because, surprise, they've been in heat the whole time. They can have variety. So we didn't talk really about that, but dogs have a lot of variety in the length of their cycles. They can have, on paper, you can have a bitch with a perfectly normal, like 8-day long heat cycle that goes through things like gangbusters. You can also have a bitch that has a 30-day heat cycle that's totally within the realm of normal. It's very expensive and frustrating to have that dog. But there's a lot of range to it. But these silent ones feel faster because we don't see all the signs and see the kind of progression of things. So there's a few different ways to detect them, but it kind of depends on your kind of what your angle is. If you're trying to catch them to breed her on, weekly cytology is going to be the way to go. So for most people, that means getting your own scope, your own stain, studying some cytology. I had some on the previous lecture if that's helpful for any of you that are looking for that. Your vet might be willing to help teach you to read those if you have a good relationship with them. I'd say especially repro savvy people, we're going to be happy to show you. And if you think they're in heat, if you think at all, if like your subconscious just says, she just looks different, you can take her in. Take her in. We understand this is a problem. We would rather, not saying it's all about business and money, but like we would rather you get to breed your bitch and that we can help you with her cycle and do all those things. Most of us will understand if your bitch has a history of like the first time she came in, she was 35 and you had no idea that she was in season. Yeah, you call us, we're gonna get you in for progesterone as soon as you can get it. Versus saying like, oh, we don't have an appointment for 4 days. Like, we'll probably just let your previous visit stand as far as your like, established connection with us. Other scenarios. So I have had some owners that want to document that silent heats are happening in bitches that have never had a heat. So like a 2-year-old, I had a 3-year-old golden bitch that wasn't cycling. That's a good example of this. They weren't really sure if they were going to breed her. She wasn't like the perfect dog for them, but they enjoyed her and they were considering it. Well, it was, initially we did an ultrasound. We kind of looked at a few things, but we basically said they're not looking to try to catch the cycle to breed on it. They're looking to prove that she's cycling at all. At some point, it became I'd like her to cycle before we spay her discussion. Well, we ran a progesterone once a month in that scenario to just say, did she have a cycle? Because if she had a cycle and she ovulated, well, her progesterone is going to be up at some point. But if you're trying to use it as a pre-breeding approach, I guess you could do the progesterone approach. And then when you caught a cycle, plan for 6 months from then to really aggressively be checking cytology weekly. Because I realized cytology weekly is a pain. But I think that's really the only way we can catch some of these guys. Another kind of weirdo one would be split heats. They come in heat, they don't ovulate, they go out. They come in heat, and then they cycle. That's usually how it goes. Sometimes they will do like the revolving door thing. Usually that's a bad scenario. Usually it's not just a simple kind of straightforward split heat. Most are the first estrous cycle. It can happen anytime though. They're very frustrating. It's like the biggest frustration for the owner because we're investing a lot of money and time, and it gets exhausting to have these girls that come in and we're really testing, because some of them will go in and they'll get pretty far before they split. They'll start looking like they're going to ovulate. We start testing them every 2 days for like, a week or so at that point, and then they go out of season, and then we got to start all over whenever they come back in season. A lot of people ask, do they cycle quicker on the second half? I think it's kind of the same idea as the split heat. You're not going to see as much proestrus, so it feels like it goes faster because you're not observing it as much. I don't think it's because they like pause and then they get right back where they started. I don't think we really know though. I mean, truly, I think most of them, it seems like they have a slightly shorter proestrus, meaning they start doing things with their progesterone numbers a little bit sooner. But a microscope at home could help you here too. So really easy to do. I mean, honestly, that a cheap microscope will do fine for vaginal cytology, and the stain's cheap and easy to dispose of. It's not like a special, like you have to dispose of it in a special way, like formaldehyde or anything like that. All right, so kind of a sister to split cycles in some ways, and ovulatory cycles. So there are bitches that have cycles where they truly don't go through and they're not splitting. They're just not cycling. They're not progressing, I should say. Sometimes it'll stall. Some dogs will never go up. So they will bleed and they will be in estrus, and they will never have a rise. Some of them will go up to ovulatory type numbers. Some of them will go pretty high, like to 8, 9, 10 nanograms per mil. Just never look right, never progress, and their cytologies look terrible. And we put semen in them and they don't get pregnant. We don't know what causes these weird cycles, but there are some things that we know can cause it. So ovarian cysts would be one. So if you have this is a picture of a big honkin' ovarian cyst from a dog ovary, and they can produce abnormal amounts of hormones that don't fit with where they are in their cycle. So that's kind of why the thought is. Same type of approach with the granulosa cell tumor. I know that sounds scary if you guys haven't heard of that before. It's actually a functional benign tumor. It's very rarely a malignant tumor, but they basically get these areas of cells that reproduced as its growth. I mean, it is like a benign growth of just the functional cells that are on the ovary. Well, if you have that, you're making too many hormones that you shouldn't be making in different ways. We also, I would say, other breed predispositions, I would say German Shepherds are like the captain of this team for me, at least in the lines that I've worked in, of having anovulatory cycles. And they're very frustrating when they are dog, but I feel like it's like 50% of the ones that I've tried to treat and push them through their cycles have been Shepherds. Maybe Shepherds and like Bull Terriers would be another one that I feel like I've seen more cysty, weird anovulatory things. Some of them do them with no structures on their ovaries too. Some of them just do this. And I think those are the most frustrating ones because we can't fix something to like approach it differently next time. They can be tough to breed. Many of them are, it's very frustrating to get them bred. Basically what we have to do, we have to document it happens the first time through, because basically we'll be timing your dog. We'll be doing that cycle just like we did with Flower cycle the other day. And then if she sat there at 4.6, 4.7, 4.9, 4.2, 5.1 and did that, well, by the time we've realized that she's just putzing around at 4 or 5 nanograms per mil, those oocytes or eggs that are there, we could make them ovulate with drug, but by that point, those eggs are toast. Like they're not happy. They're not going to make fertile embryos. So we make them ovulate. We might put semen in them just as a Hail Mary. I usually just tell people like turn them out in the yard with like a stud dog that you have, just for like if you wanted to just see if you could get her pregnant, or like the stud dog that you're planning. But don't go to great lengths. Don't put frozen in her. Don't, ship semen from across the country and spend a bunch of money and sign a stud dog contract that you can't get refunded on. Like don't do all those types of things. The second cycle, so after we've forced her out of that cycle, we can then purposefully plan for that on her following cycle and assume that she's going to do it again. A lot of these girls do this every single cycle and their owners are frustrated and they'll describe it in their history and they'll have lots of progesterone testing history. But yeah, there are drugs to help. I would say this is definitely more of an advanced procedure and not a lot of practices have a lot of experience, but there's lots of good resources for your vets as far as protocols out there, lots of different protocols too, so I didn't even list them here, but hormone manipulation type drugs that are out there. I think the best resource for searching those sorts of things would be VIN, VIN for your vets. If you're looking for, if you have that dog and your vet's been saying like, I don't know what to do with this, we don't think we can fix her, and you don't have another option locally to go to that could help you, they might be able to help guide your vet to do some of those things. Oh, if your dog has a GCT, so that's that granulosa cell tumor, if it's on the one side, so usually these are real obvious on ultrasound. Like some of them are small, some of them are big. They can be big. Like I had a Great Dane that had one that was like, probably I'd say like softball sized on one side, like big mamma jamma. Actually, one of my bull mastiffs, her mom, it was a post-mortem exam, unfortunately. They didn't find it for a long, long time. And her owner, unfortunately, my dog's owner didn't want to do surgery. She was 6 or 7, I think, when they found it. It's not a breed that lives for a long time. And I think she was having some other health issues. But they didn't end up doing this like real advanced procedure with the boarded surgeon because they were like, they're going to have to send her to specialist after specialist to like get this tumor out. Well, it ended up being her ovary. It was one of these. And so they can grow to huge sizes, but most of the time you notice cyclicity weirdness. So like in that case, I'm pretty sure like that bitch probably was having silent heat, weird heat stuff. And like maybe it just wasn't being noticed. If they're not giant, I think doing what's called a unilateral ovarectomy, which means we take out the ovary on the side that's wrong. So if we do an ultrasound and it looks like this on the right, that's not very big. So that's only 3.2 centimeters. That's like 1.5 inches across. It wouldn't be a difficult procedure at all for most practitioners, but you can see the ultrasound would look very different than a normal ovary. We'll take out the side that's not right. They can cycle from one ovary. So they can cycle and carry pregnancy and everything goes super smooth by taking out the abnormal one. That's the case for many species. So we do that in other livestock species. And I think they can do it in humans as well. They'll take out the one abnormal side and then you can go forward and get pregnant from the remaining ovary and have normal hormonal profiles. For cysts, usually we'll try to use drugs to resolve these, if that's the cause. It's kind of the same concept as what we were talking about a little bit ago, where we have to kind of force the cysts to go away. We basically, a cyst is an egg that didn't ovulate. It's basically just a big overproductive egg that would never did what it was supposed to do. So the drugs that we have right now, we do have available. We don't have all the ones we wish we had. Many of them are under fire, unfortunately, because of government-related issues. All these drugs are abortive drugs. That's all of these drugs that we use for management. Some of them will not be touched because we've had them in livestock for years, and so I don't think that they'll go away. But there's a lot of things that we wish that we had that either the companies stopped making, or politically it's too hard to enter a new drug into the market. Like, there's just no way to get them. So we do have some things that work okay in the United States. Some of you guys, if you're from overseas, you might have some more options of things that your vets might recommend. There's also a mention of surgical lancing and aspiration. I've never done this, but in theory it can be done, where you can go in and like lance and drain it. I think I've always just been taught to use drugs in these scenarios, or certainly GCT, you'd have to take it out. Okay, so a little bit on progesterone trends in pregnancy. So some of you guys may already be aware, we've already shared this graph, but we do have some interesting trends. So these trends happen in the same ways, just so you guys know, for both a pregnant and non-pregnant dog. I just thought you guys would want to know that for like bar trivia, but the trends do the same things. Progesterone does the same thing. Sometimes progesterone, it'll trail off a little bit slower if they're not pregnant, but they go to the same heights and kind of perform the same way. We don't have an EPT or a equivalent, what we call it is maternal recognition of pregnancy. We don't know that it actually happens or has like a hormone associated with it, like we do in people or some other species. Dogs, I think because of how they were developed to support each other in a pack structure, and in most wild canids, there is a dominant pair that would produce offspring, and everybody else would do everything the same way. They'd cycle together, they'd lactate together, even if they weren't pregnant. And that was just for survival of the fittest means. So, but during pregnancy, progesterone can do funny things. It should do this, but if it doesn't do this, they can lose the pregnancy, right? We will often we'll think about progesterone testing in pregnancy for dogs that have history of failing to carry to term. Now, it might not have been the primary cause. So oftentimes, if they failed to carry to term last time, and say they had an infection, say they had, like I have several in mind that had bacterial abortion, basically. So they started having an infection associated with their placentas or their uterus, and started to try to lose puppies. Well, we think, having those types of histories, well, they have kind of an effect that's not necessarily going to repeat itself. Because if they didn't get an infection next time, they might not have that problem. Still, it might be worth checking her just to say she's not trying to do it again. Familial history is a biggie. There are definitely lines, and you guys are out there, I'm sure you know, there are lines that this is endemic. It is every bitch, and we have started selecting for this because we have enabled it. And I hate to say that because I'm part of it, but you really love this bitch, you really want to go forward with her, and you will do anything to stand on your head to help her carry to term because she's the best dog you've ever bred. And then you keep her daughter, and her daughter does the same thing, and you already know how to do it. So you just do it again. And then you just keep going and keep going. Portuguese water dogs, Newfoundlands, Shepherds. There's certain breeds that I feel like it's like part of their expectation almost. Corgis, some corgi lines are like that. The owners, they've got Regimate from last year at home. Okay, that's good. And then they already know what to do. So sometimes we'll run a progesterone, or might suggest running a progesterone if a dog comes in for an ultrasound for pregnancy routine, and they've got more than a couple of resorptions. Every dog, if you're doing a really thorough ultrasound, we're going to see resorption sites because pregnancy is not perfect, and sometimes things just don't add up right or land right. And it's not necessarily that she's got a massive problem, but if you look at if you're scanning this Bichla and we think she has 8 puppies and 4 of them look suspicious, like one of them's going away, one of them's completely gone, one of them's just an open gestational sac, I am definitely running a progesterone on that dog while we're there. Now, again, could it be that she has an underlying problem that's causing her progesterone to be low? It's hard to separate that. So, but we know, we can at least adjust progesterone if on that end, we can address that as an individual component of kind of supporting her pregnancy. I also am a fan of taking progesterone at any point. If there is unusual discharge, it is part of my recommendations. If your bitch is 6 or 7 weeks and she already had an ultrasound, we're going to ultrasound her again, but I'm going to run her progesterone if she's doing something abnormal. If her progesterone is high, it gives me a lot more confidence that something really bad isn't happening, even though it still could be. You might also run one if she's not pregnant, and we might run them in order to prepare her for uterine biopsy testing, which we would do at the end of diestrus, which is basically when she's term, when she would have been term if she didn't take. But yeah, I think a lot of owners just would feel better saying, yep, her progesterone is high when she didn't get pregnant, as far as ruling out a possibility of a cause. So I know we already talked about this, but in general, most common points in time, pregnancy ultrasound date is sometimes when we will run these. If they have a history of loss, so if they had their dam had needed supplementation and they're worried, and it's, high profile litter, first time she's been bred, etc. I think 2 to 3 weeks, we might check it at pregnancy ultrasound timeframe, but I think honestly, we can't use a lot of predictive value for that because it might be 25, it might be 45, it might be 15, and those could all be perfectly reasonable numbers for her to hold and trend perfectly fine. I think that last 2 to 3 weeks is usually the problem area. So I think if you really wanted to be aggressive, you could test her weekly from the pregnancy ultrasound. If everything was normal, but you had a history of suspicion, but definitely by -3 or 2 weeks prior to term. There are dogs that just defy odds. I've had clients that supplemented the first 2 cycles, and then they finally, the last time that they bred her, they said, we're just going to see what she does. The last 2 times we bred her, we supplemented her when she dipped below 5 nanograms per mil, and that was what the owner wanted to do, and we were good with it. Last time she just let it ride. Oh, she was fine. She carried him to term, no problem. So she had convinced herself that there was a cryptorchid association, which is not a thing, but she has a very high cryptorchid rate in her line, in the breed, has a lot of problem with it that she was dealing with. But anyway, it's just one of those things that she wanted to say it was cause and effect, and sure enough, she had more cryptorchid than the next one, so didn't prove it. Oh, what might cause the drop? There is something that it's kind of a hot term on the Therio side. It's called familial hypoluteoidism. The luteal structure, so the corpus luteum, is technically this little orangey, spongy guy that's tucked in these. This is a split section of an ovary, but you can see those little guys that look like orange jelly beans. That is the corpus luteum, which makes the progesterone for pregnancy support. So the idea is hypoluteoidism means that the luteal structure on the ovary becomes small, or hypo, right? Hypo being less than acceptable. I think it's possible that this is a thing, but there are a lot of theriogenologists that say this is not a thing. I think it's probably a 50-50 split of us. So the argument against it is, are these dogs do they all have irritable uteruses instead? So if your uterus is unhappy, your progesterone is going to go down. So is it truly that they have ineffective luteal structures, or is it that they are unhappy with their uterus? It's probably going to be one of those things we argue about for the next 40 years. I have no idea. But regardless, it tends to affect certain familial lines, breeds. And essentially the thought with the uterus is, if your uterus is upset, so if you have an infection, if it's irritated, if it has issues, it's going to stimulate release of hormones that basically downregulate the ovaries to have those structures that make the progesterone. It makes them try to go away. So if we get rid of the irritability or infection, which can be done sometimes with drugs, sometimes we can make that progesterone stabilize or go back up. But we can give them progesterone, but sometimes we also have to fix whatever's going on underneath it. They can have, again, the early drop. Sometimes they're individually variant, they're fine, and we just get a little jumpy. There's also protections of like, could stress cause it? If you have systemic trauma. So I had a super bad dog fight, where this dog got in a fight, and basically its entire back was just bit up, and we flushed the tar out of it and cleaned it and had her on drug or antibiotics, and I think we even put her on NSAIDs, and she held her pregnancy she was probably 6 weeks pregnant, and she held for about a week and then lost it. And I think it was just from like so much inflammatory trauma. Like you just can't combat that. And sometimes they'll have that much trauma, also have, kind of hormone release because of that, and have problems. All right, so when should we test? It's highly dependent on the numbers we receive, right? So if she's less than 5, that's usually when most people will be like, oh yeah, she needs drugs now. Greater than 5, I usually recheck them tomorrow or the next day, kind of depends on how urgent the owner is and how much, how important it is for them to make sure this bitch carries. Greater than 10, recheck in 2 to 3 days is usually my feeling. Greater than 15, week out, she might be totally fine, but like if you want to check her, there's nothing wrong with checking her sooner than this. The more tests you run, the more you know, right? But it's expensive. So if she's greater than 20, she's doing fine. I mean, most dogs, like especially if you're testing them, I mean, even if you're testing them and they're at their pregnancy, I'm like, most of them are just fine. So, all right, so options for supplementation. So you guys are aware, you guys probably have seen one or both of these if you've had this happen to you. There's an injection that's called progesterone oil that you can get from most local pharmacies, because they actually use the same product in women. And the progesterone levels can be guided or can guide the frequency of use. So basically, most of these guys, we give injections, I would say bi-weekly. Some dogs need it more frequently, like every other day, but we basically will give them an injection and run progesterone to try like a series of days to try to see like, okay, one injection lasts for about 3 days for her before she kind of dips back to levels where we would feel like she needs more. And that way we give her as minimal as we can, but in order to sustain. Once we know her patterns, then we don't have to like obsess over progesterones as much. But I think it does require a little bit more intensiveness. Regimate is an oral product. It's called Alternagest. We're blanket treating with Regimate. We cannot test for it. So her progesterone, if you run it after you've started Regimate, it will show you what she actually was going to do. So I guess interesting academically maybe, but you can't measure Alternagest as a part of progesterone. It doesn't work like that. So we are just giving them as much as we need to for the like average patient, as we need based on their body weight every day, and that's just what they get. When using any supplementation, either one, use very like large caution with these. No handling by pregnant women. I wouldn't even say the injections, even though we're more concerned about Regimate for pregnant women. Wear gloves for any administration. Just continuing wise, for free whelping, we want to have her progesterone become low between -2 from her due date to 0. Regimate, usually that means discontinuing based on their like product recommendations. It's 72 hours to 48 hours prior to due date. Will help them to be in delivery by the due date is basically the thought there. If you're having a C-section, don't forget to take her off of it. We don't want her to go into premature labor, but we're also going to have some impacts on things. One of which, I know I'm skipping past the first bullet there, one of which is agalactia or poor milk quality. So if we just leave her on progesterone or on Alternagest Regimate until the very last minute, and she's been on it for a while, we're just encouraging her mammary glands to be less active, which is not what we want, right? We want them to be active. So that's one of the side effects. The other major side effect that people are kind of aware of, and I think it's talked about some, is masculinization of female puppies. So what this means, masculinization being female puppies that appear more male. It's usually, so this is a picture on the right of a male puppy, and the puppy on the right is a female puppy, but you can see, like, look where the end of the dog actually ends. That vulva is kind of rotated under a little bit. That is because basically we were giving a drug that was being computed out to be testosterone, even though it starts as progesterone. It has the testosterone-like effect in these puppies. So if they're trying to figure out where their sexual development goes and their organs should go, sometimes they start to drift toward the male direction, even though they were trying to be female, that they kind of can't figure out where it wanted to be. We don't tend to go forward and breed any of these girls, but we assume that they would also be infertile even if we could figure that out and if they had normal tracks and such. But masculinization in like livestock species, when we have twins, so like twin calves, girls that were in the same, like if they were sharing the same blood supply as a male calf, those female calves are sterile. They have very little reproductive tissue, like their uterus is very small. It's called a free Martin, but I would presume that probably happens. We just don't see this a whole lot because most of us don't supplement them early enough to see this. It really is, it's more typical in a developmental stage versus like a week before term. That's pretty far along where they're pretty well cooked at that point. They're not going to like have rotation of their organs after they've already kind of settled where they want to be. It's more like mid-gestation that we would see progesterone numbers were dipping, and the owner said, I think I want to just do it because I'd rather have a pregnancy and we'll just hope for boys. And then they end up with a litter of girls with these unusual anatomies. Okay, and then just a final couple notes. I know we're a little bit over time here, but I figure we can probably get through just a little bit on elective C-sections. So it's pretty basic. Basically, we base the date that we start timing for elective C-sections, we base on their ovulation timing. We don't always have that information, but usually if we're doing elective C-sections, we are, because there's exceptions to that, but we don't want to be predicting numbers based on measurements and be wrong. And a lot of those cases where it's tricky when we have like a breed that we know can't have a natural birth, maybe like a really large singleton puppy from a typical breed, or maybe a Frenchie that was bred accidentally or something like that, and the owner didn't know that they needed to have timing for an elective C-section. We might have to kind of play some guesswork, but a lot of times we will try to let those bitches go into labor to have better assurance of what's going on. We can try with measurements, but the best thing that you can have is ovulation timing. So 61 to 63 days from ovulation documented with progesterone, 63 to 65 days from documented LH, and they can have some effect based on their litter size. So if you have, say, this Ridgeback had 3, well, she's going to carry probably longer, like go into labor later and need a C-section later than a bitch that has 14 Ridgeback puppies, which can happen. They could totally be opposite, where the bitch with 3 wanted to go earlier than the bitch with 14, but usually the bitch with 14 will go first. Breed can affect due date too. So there's a few breeds that tend to be, and I'd say lines that tend to be a little bit early. I have a Labrador breeder that tends to, well, -3 is a pretty common thing for her line, which is weird, but I would say most of her like elective C-sections, most of the time we are doing a -3 C-section, if not not -4, but she's often in labor by the time we're checking her the first time, even with a moderate size litter. Whereas like I'd say Cavaliers are like the poster child of being a little bit, some people want to claim that they have a shorter gestation length. I think it depends on who you talk to. Most of us think a lot of times when they whelp, they are whelping and they look a little preemie. So we think that maybe they just don't want to carry to term like they should, but they are trying. Their body just doesn't carry them as long for whatever reason, but they're still old enough to survive. That's kind of what we think. But Cavaliers are like the ones that I would say some of us will check -4 on a Cavalier for that reason. And I mean, I know you guys already know this at this point, but We do not cut based on breeding dates for obvious reasons, because they can have such a wide range, and it's such a narrow delivery range, but in actuality, from breeding date, we have no way to predict it. All right, so -3 or -2 from calculated due date is the first day we're going to see you if we know your due date. We're going to base that again on litter size, maybe her individual history. I just had a Great Dane that I cut about a week ago that she had a litter of 10. Last litter, she did a free whelp on +1 with a litter of 9 or 8, maybe. I'm like, surely she's gonna need her C-section by -1. No, she's still with 10. 2 years later, she still wanted a +1. She was showing no signs of labor by her due date. But at that point, we felt like she was in good shape physically. So other thing to consider would be active risks. So is she having issues with her pregnancy? Is she having pregnancy toxemia? Is she diabetic? Is she having some kind of a secondary problem where we're trying to go to surgery and do a C-section as soon as we can? Well, we might not be leaning into progesterone as much on the backside, and we might just say, once she is approaching these ranges, we're using ultrasound to deliver. Usually we prepare progesterone daily with ultrasound, and the trends can vary. So I have had dogs that sat at 3 for 3 days. I have had dogs that went from 10 today to 1 tomorrow, and we're in labor tomorrow. So there is no rule as far as like how they want to trend, but just so you know, more bar trivia, the cause of the temp drop that everybody likes to focus on and do, which I think is perfectly fine to track at home, that is actually a reflection of the progesterone drop. So if the progesterone drops precipitously, that is what causes the progesterone. Happens to be a thermostatic hormone. It has lots of properties that affect your body temperature. So when that happens, that's when the temp drop happens. Some dogs, though, if you have the dog that goes 9, 7, 5, 3, 1, you'll never see a temp drop, but that bitch will go into labor. If that dog goes 10 to 1 overnight, well, yeah, she's going to have a very pronounced. She'll probably have a 2-degree temp drop on that dog. So again, daily testing until their term for these pre-C-section girls. For singletons, some of them, so I'll run them the first day we see a singleton. So if we're like -1 from our due date, or maybe -2, we'll run them. I will base my C-section on ultrasound in those dogs, unless her progesterone is telling me I need to go sooner. And that she's going to go in labor regardless, then I would rather get that puppy out and have it be healthy, if their plan was to do a C-section. They won't always drop. I mean, I've had some of these girls that were 14 on their progesterone when they were cut for their C-section. And I think for some of these, the first one, if it's high, if it's 14 and we have you come in the first day, I'm not going to have you check one tomorrow. If I tell you, puppy doesn't look ready today, we'll just go back tomorrow. I will double check her due date and make sure we were really happy with our timing and how clear it was. And if we know she was due the next day, she's getting an ultrasound and we're doing a C-section that day. Like that's much more practical, because some of them, the thought is if they don't have enough puppies to recognize that they needed to go in labor, one puppy for some bitches will just not tell them their body is ready, and so the progesterone never goes down in the traditional sense until postpartum. So be careful with using milk presence as a criteria also. I feel like people want to put value on, vets and owners. I would say, if it's not there, I am reluctant to cut if it's not present a little. But if everything else is green lighting me, I'll still go forward. I just might be a little bit more aggressive with using oxytocin in surgery when we're doing the C-section, and maybe giving her oxytocin postpartum just to help with milk development. And we have other drugs we can use to bring them in, but I think sometimes that's like a clue that says, hey, are you sure? Like, I think that's the only reason that I would change my feeling. So things we look at, just to mention at close here, we look at ultrasound of different parameters. So there are things that we can use to estimate age. There are things that we can use to estimate maturity. So I've listed some of those things here. But basically, like you can see on this ultrasound, we have these like really nice, distinct parallel lines. Those are intestinal loops, and they're really bright and demarcated. That's a really common appearance kind of at term, and we'll often see motility, which is quite nice to see. So I saw you popped on, Nicole. This is, I promise, we're 2 slides from over.
Well, take
I'm
your
just gonna
time.
show, are you okay if we show these videos? Are we still okay?
Oh yeah, go ahead, take your
Okay.
time.
Videos are fun, so I just feel like we should play them. So this first video, I believe, is going to show you some renal maturity, so kidney maturity. So what you're looking at initially, just to orient yourself. So on the left is like the liver, the right, you're going to see the intestinal loops, and then you'll see the flash of this, like kind of centrally there, you'll see the flash of a kidney. So it's got like lots of little black holes within it, and then kind of has some like little hash marks. That is a fully developed kidney. You can see the heart kind of flash in there on the left too. And then, oop, playing it again. And then this one shows you some peristalsis of the intestines. So the intestines are pushing ingesta through the intestinal loops, and that is the last thing that we can appreciate on ultrasound before they are term. So you just kind of focus on a spot, and you'll see some areas just kind of independently push through and kind of wiggle around, kind of like a worm sometimes is what it'll kind of look like. But yeah, you're just focused on the kind of train track areas that are in the center of the screen. And sometimes this can be really hard to see because sometimes they're panting and they're not happy because they're on their back, or they're pregnant and they're panting because they're pregnant. You know, it just happens. So I didn't have a summary slide, but that was the end of the talk there. So basically, you know, in summary, progesterone can be used from a lot of perspectives. You know, I know we've talked about a few different uses. I think the primary use that we think of is the ovulation timing side of things. I think there's a few other places that we can use it that are helpful in medicine, but I think that's the key place is really on the front side of timing for us to really be able to have more power throughout the cycle, and even interpreting what the progesterones are doing during cycle if we have that early knowledge. So I think, Nicole, you can take over if you want to field some questions. I'm sure we probably have some.
Yes, definitely. So we have a few. The first question that came in is about reabsorption. Does it have any impact on progesterone results and when to test, or any impact on future litters?
Yeah, so okay, so resorption does have an impact on progesterone levels, but I think it's because something is causing resorption. So for the most part, usually there is something going on. So if she's got an irritable uterus, so it's contracting inappropriately and is active inappropriately and making it a hostile environment for the fetuses, she might have an infection. We see resorption from I would say like significant trauma. So just like we can see abortion from significant trauma. Like, I mean, just think of, I know it's terrible to think of, but just think of like a woman that gets in a car accident, has like extreme moment of trauma, can lose a pregnancy just from like the abnormalities and that kind of association. So I think early pregnancy loss is the same. But I think the progesterone level, what we understand in general, the progesterone level is more of a secondary flag, meaning there's something initial that's causing that resorption. But in the scenarios we talked about hypoluteoidism, well, in that scenario, maybe some people are arguing it's its own device, that it is the lack of that those structures on the ovary are not sticking around because they're just not functioning normally, and that's its own issue. What was the second? There was a little bit of a second part on that I've already forgotten.
And how does it impact future litters was the second part.
Future litter. So some dogs will resorb every time. I would say some of the times though, we are trying the same pair. So we're breeding the same dog to the same bitch, expecting the same or expecting different outcomes. And I think some of the times there are stud dogs, just so you guys are aware too. I didn't list that as a mention on resorptions. There are stud dogs that are great at getting bitches pregnant and they all resorb. I think any resorption just means an embryo that goes away, that kind of established and then went away. So there's lots of potential causes for that. some of those might be familial and hereditary, and that might just be part of her DNA and like what she's doing, or maybe it's something that in her husbandry that's repeated, or the way that she's bred that's repeated. So it could happen again. And I would definitely, in ones that do it, especially if they totally resorb to litter, we will ultrasound them earlier the next cycle. So we'll check them sooner, because if we're checking them and we're seeing resorption, we're not getting there early enough.
Got it. Thank you for answering that. We had
Yeah.
another question from Sophia, who's wondering when you would start those weekly cytologies for the silent heat bitches. Is it close to when their heat is expected, or at some other time?
Yeah, so the trick is, for a lot of these girls, they're all silent. So like their whole heat history. So like we don't even know if are they 6 months apart? Are they a year? Are they annual cyclers? And I think that's part of the mystery for most clients. If they're frustrated and they can't figure out when they've had a cycle. So maybe the answer to this to some degree is, do you think that she's a heat cycle dog that never shows signs, and you're just trying to document it and find it? Or did you catch one at the end of the cycle? If you caught one at the end of the cycle, well, we know we can't really breed her before 5 or 6 months after that cycle. So you could, in theory, I'd say wait 5 months before you started doing those cytologies to try to catch her. That's actually probably the best approach. If it's from a breeding perspective, that's probably what I would do. Otherwise, it's just weekly forever.
And then we saw a bunch of questions about this come up in the chat, and I was wondering if you could repeat how you would use progesterone levels to figure out a dog's heat cycle.
Yeah, progesterone levels to figure out for timing.
Mm-hmm.
Okay, yeah, let me go back. Do you want me to just go back and we'll go back over flower for a little bit?
Oh, sure.
You can just do that. I don't know if that's what you're meaning on the.
Yeah, I think that's exactly it.
Okay. All right, so we'll go through this one again. So this was, again, this was my personal dog, and this is her actual timing from when I bred her back in, oh gosh, it's probably been 15 years. So she came in season. She's had a normal history of heat cycles. She came in season on that Monday, the 15th. Since she's had pretty normal heats, I started her timing a week later. If she was a dog that was the silent heat dog and I thought she was showing signs of heat, I would try to get her in the 16th. I would try to get her in right away. But since she's a pretty average dog, I think most vets will recommend 5 to 7 days if it's a typical like heat history type dog. So the first day that I checked her progesterone, she was 1.4. And then the next day that I checked her was 2 days later. And the decision making there was she was already kind of doing something active. So like if she had been really low, like say she was 0.2 on the 22nd, I might have checked her on Wednesday, but I probably would have waited till Thursday. You might even have been able to wait till Friday if you had really good quick access to your stud dog. I think it's just always one of those things. We're trying to do as few tests as we can to get the information we need. And sometimes the right answer is doing more testing is going to be safer bet. So for her, she's still kind of hovering at 1.4. So she popped up at that point on Friday to 4.2. And by Saturday, she went up quite a lot. So we define the rise, and I'll pull up a summary slide from the other presentation to help with this, because I know some of this is just trailing from last week. So that the old adage of 5 is when they ovulate was how we used to say ovulation timing worked. But now we know a little bit more. We know they don't all ovulate at 5. This dog ovulated at 4. So she ovulated because she went up 3 points in nanograms per mil, which is the value that we check in, at least in the US. That's how we measure things in progesterone. She went up over 3 points within 24 hours. So if her Saturday level had been 8, I still would have said she ovulated on Friday. If her Saturday level had been 15, I would still have said she ovulated Friday. It didn't matter how dramatic that spike was, at least 3 going up 3. If she had been 7.2, she ovulated on Friday. It would have followed the same scheme. So from there, we timed to breed based on the weekend. Since we were shipping semen, I couldn't get semen until Monday. And then I got semen again on Tuesday. And I meant to say too, she had a litter of 6. So she actually had more success with this as a 6-year-old dog than she did when she was 4. Let me show you guys. Let me see if I can find the other PowerPoint really fast. Sorry, you get to see my other things and how disorganized my life is.
It's okay. If people saw my desktop, they'd be pretty horrified too. All of the loose documents, tabs, screenshots. I think everyone has that.
All right, so let me see if I can pull up. Okay, so this slide I think is going to help. Okay, so this was from last week, but just so you guys can see. So we're confirming ovulation based on the trend of 3 nanograms per mil rise in 24 hours. We don't always get to see that, like, we ran progesterone today and then we ran progesterone tomorrow. We don't always get that gift. So sometimes we're inferring what happened in the last 2 days. Sometimes we don't know the answer and we have to kind of assume what happened. Most of them ovulate between 4 and 10. And after 10, we know they've ovulated. So that 10.9, if we didn't run a progesterone on flower, if we go back and we say we did not run a progesterone, and oops, I gotta go back through. So if we say we didn't ever run a progesterone on Friday, say something happened, bad weather, the lab lost the sample, whatever it is. All I had was Wednesday 1.4 and Saturday 10.7. I know she has ovulated at 10.7. I know that she had. So I can infer then, kind of back calculate and say, okay, if I know that she was 1.4 on Wednesday and I know that she was 10.7 on Saturday, I can say, well, at 1.4, she couldn't have had her LH surge yet with what she's done in the past. She has to have a couple of days from her LH surge to ovulation. So she had to ovulate on Friday. So sometimes we have to play guesswork like that. And a lot of times it's like I said, lab errors. Sometimes it's like, oh, the lab's not open on the holiday, or the vet's not open on the holiday, or maybe they thought the lab had an error, or, you know, things happen. So does that kind of address what the questions that you were thinking?
Yes, definitely.
Okay.
Thank you for going over all of that. I think that might have been one of the last questions that we have. Thank you again for also staying over our allotted time to go over all this.
Yeah.
It was such an amazing presentation. We are so glad to have welcomed you back again. We're going to have you back very soon. I know our community appreciated both of these presentations so much and learned so much. And to everyone joining us, if you want to rewatch this, if you want to watch part 1, we have recordings of both of those, so you can watch them as many times as you like, take as many notes as you need to. But thank you all again for joining us today. And if you're not yet a member of our community, you can apply to do so at gooddog.com/join. And before I let everyone go, I want to leave everyone with this exciting thought and reminder that our 4th annual health symposium is coming up. So October is not just going to have 2 webinars, it's going to actually have 4, and they're going to be all under the common theme of creating the best possible breeding outcomes for your program. So we'll be announcing all of those tomorrow morning. You can register and make sure you attend all of them throughout the month of October. They're completely free for all dog breeders, whether you're part of the Good Dog community or not. And we're going to be bringing back Dr. Carla Barstow and Dr. Fran Smith for some more talks. We're really excited. And if that's not incentive enough, we're also going to have giveaway opportunities for people that attend, which I know everyone loves. So yeah, like I mentioned, those will be going up tomorrow morning, so everyone can RSVP. But until then, I hope everyone has a wonderful evening, and we'll see you at our next webinar. Thank you, everyone. Thank you, Dr. Hesser. Bye, everybody.
Thank you, guys. See you later.